In this podcast episode, Dr. Georgia Eid, a Harvard-trained psychiatrist specializing in nutritional and metabolic psychiatry, delves into the profound effects of the ketogenic diet on mental health. Dr. Eid's work emphasizes the connection between nutrition and brain function, challenging conventional views on mental illness and its treatment. Dr. Eid highlights a study where patients with bipolar disorder, major depression, or schizophrenia experienced significant improvements after adopting a ketogenic diet. Remarkably, 43% of participants achieved clinical remission from their chronic mental illnesses, and 64% were able to reduce or eliminate their psychiatric medications. This raises an important question. What causes the chemical imbalances that lead to mental health issues in the first place? Dr. Eid explains that inflammation, oxidative stress, and insulin resistance are primary drivers of mental health conditions. The ketogenic diet, originally developed in the 1920s to treat epilepsy, alters the brain's operating system by changing how cells receive energy. By switching from a high-carbohydrate diet to a low-carbohydrate ketogenic diet, the brain can heal and function more effectively. Dr. Eid shares her personal journey of health decline in her early 40s, which led her to explore dietary changes. Despite following conventional dietary guidelines, she experienced chronic fatigue, anxiety, and depression. After experimenting with her diet, she discovered that a low-carbohydrate, high-fat diet resolved her symptoms. This experience motivated her to study nutrition extensively, leading to her understanding of how food impacts brain health. She emphasizes that nutrition is a powerful tool for improving mental health, often more effective than medications. Dr. Eid identifies three fundamental principles of nutrition: nourishing the brain with essential nutrients, protecting it from damaging ingredients, and energizing it through stable glucose and insulin levels. The field of metabolic psychiatry is relatively new, focusing on how food affects brain metabolism and mental health. Dr. Eid explains that many mental health conditions are not merely the result of chemical imbalances, but are influenced by metabolic dysfunction. By addressing these root causes through dietary changes, patients can experience significant improvements in their mental health. Dr. Eid's approach is not about prescribing a one-size-fits-all diet, but rather encouraging individuals to explore dietary options that work for them. She emphasizes the importance of personalization in dietary choices, as each person's metabolic health and preferences vary. A key aspect of the ketogenic diet is its ability to lower insulin levels, which is crucial for fat burning. Dr. Eid explains that high insulin levels prevent the body from utilizing stored fat for energy, leading to weight gain and metabolic issues. By adopting a ketogenic diet, individuals can stabilize their insulin levels, allowing their bodies to burn fat more efficiently. Dr. Eid also discusses the psychological aspects of food and how dietary changes can impact mental well-being. Many people struggle with food addiction and cravings, often exacerbated by the modern diet high in refined carbohydrates. The ketogenic diet can help break this cycle by stabilizing blood sugar levels and reducing cravings, leading to improved mood and mental clarity. Throughout the podcast, Dr. Eid addresses common misconceptions about the ketogenic diet, such as concerns about nutritional deficiencies. She argues that animal foods can provide all essential nutrients, and while fiber is often touted as necessary for digestion, the body can function well without it. The key is to understand how to nourish the body effectively and to recognize that many beliefs about nutrition are based on outdated or untested theories. Dr. Eid emphasizes the need for a supportive environment when making dietary changes. She advocates for a team approach involving dietitians, therapists, and medical professionals to help individuals navigate the challenges of adopting a ketogenic diet. This support is crucial, especially during the initial transition period, which can be difficult for many. The podcast also touches on the potential benefits of the ketogenic diet for conditions like ADHD and anxiety. While research is still emerging, Dr. Eid is optimistic about the possibilities, noting that many individuals report significant improvements in their symptoms after adopting a ketogenic lifestyle.